Kimberly Dunbar.
Trent Delmar.
Haley Dunbar.
Bryce Guernsey.
Cassidy Gordon.
Megan Dunbar.
Life and death. If you could save a life, would you? If you knew how and what to do, would you do it? I think most people would. They'd want to help someone in need, and I know if it was a family member or a loved one, you would want to. Did you know that 90% of cardiac arrest patients die before arrival to the hospital, according to the American Heart Association? Effective CPR performed by a bystander in the first few minutes can increase the chances of survival by 2 or 3 times, according to the National Safety Council. When you stop breathing for longer than 4 minutes, your brain does not receive oxygen, and you can suffer permanent brain damage. After 8 to 10 minutes without oxygen, brain death occurs. If I told you that you could save a life just knowing one aspect of CPR, would you learn it? Would you feel comfortable performing it? I think you would. So let's begin. CPR is easy to learn. Once you identify an emergency situation, the first thing you need to do is activate the emergency response system, and you need to decide to take action. Compression-only CPR is gold standard in an emergency situation. If you witness a person suddenly collapsing or find a person unresponsive, first activate the emergency response system by calling 911 or having a bystander call 911. It is important to check for responsiveness when finding someone down. If a person experienced an overdose, they may be unresponsive, but they still might be breathing. It is important to call 911 immediately. After calling 911, start chest compressions. The goal is to depress the chest at least 2 inches in depth and at a rate of at least 100 to 120 a minute. The American Heart Association recommends using the beat of a familiar song. The song that I use is Staying Alive by the Bee Gees. Beginning CPR, you're going to find the center of a person's chest, the notch just below the breastbone. You're going to put your palm just above that notch, put the other hand on, and interlock your fingers. You're going to keep your elbows straight, and you're going to push down hard. The depth is going to be at least 2 inches. Staying alive, staying alive, staying alive. That's how fast you have to go. At least 100 to 120 a minute for effective, high-quality CPR. You continue to give CPR until the EMS arrives. If there is another bystander that knows CPR, switch off every 2 minutes or earlier if the chest compressions are not high quality or that patient becomes fatigued. There are many misconceptions that may prevent people from performing CPR. One of them is that you would be held legally responsible for any negative outcomes. This is untrue, and that's based on the Good Samaritan law. It protects you. Another misconception is that you could injure someone or cause further damage. If a person is not breathing without a pulse, they have no chance of survival without immediate intervention. So any damage you do will be far less than them dying. In conclusion, CPR is the best chance of survival in cardiac arrest. Learning hands-only CPR can significantly increase the chances of survival for someone you know or someone you love. Thank you.